Welcome to the North American Spinal Cord Injury Consortium. My name's Jen French. I'm the Vice President of the Consortium, and we're here today to talk about getting involved in spinal cord injury research and what we do in terms of project engagement. So today, we're going to talk about what the North American Spinal Cord Injury Consortium, or what we call NASCIC, what we are and why we're reaching out to you today, what projects we have for active engagement, what types of engagement you can expect becoming an advisor, and what is this project engagement database and how we use it to recruit people for projects. And then we're going to go into the introduction of the SCI research advocacy course and how you can get involved today. So what is NASCIC? We're the North American Spinal Cord Injury Consortium. We serve people living with spinal cord injury, their families, SCI-led organizations that work on the local, regional, and national level across the countries and territories within North America. And we do this by facilitating communication, research, sharing resources, enhancing collaboration, and really to improve four things: research, care, cure, and policy. But we're doing this all as a collective community of us living with spinal cord injury. And we help do this by doing effective partnerships, not only with you and people living with spinal cord injury, but with all the other stakeholders, government agencies, research institutions, healthcare facilities, and industry. And really think of us as connecting the dots to be able to connect all the stakeholders within the SCI community. We've only been around for a short period of time, but we've grown over the last 3 years to over 340 members. That's individuals living with spinal cord injury, their families, their caregivers, the multitude of organizations that represent people living with spinal cord injury and stakeholders. If you're not a member, why don't you go ahead and join? It's free to join, and the link is right here, and it's also on our website to join for free. So why are we reaching out to you? Well, the inclusion of all stakeholders throughout the research process will yield a stronger, more relevant, and more useful result for the SCI community. But more importantly, people living with SCI bring an expertise that is historically missing from the research teams. And as we recruit for projects, we rely on people like you who have lived experience, who can become advisors to these research teams. So why does advising and engagement matter? Well, for a lot of reasons, but even the FDA in the United States has put out some draft guidance in 2019 to talk about engagement and help to define it. And how they define it is that engagement is an intentional, meaningful interaction with patients that provide opportunities for mutual learning and effective communication or collaboration. So they also provide some clear definitions for us, the difference between somebody participating in a clinical trial and someone who's an advisor. So a participant in a clinical trial are individuals who are or become participants in research, either as a recipient of a treatment or as a test or a control. Whereas an advisor includes individuals who have experience living with a disease or condition and can serve in an advisory or consultative capacity to improve clinical investigation design and conduct, but who are not study participants. So what we are talking today and what we're doing here at NASCIC within our project engagement is really trying to find advisors to be involved in research projects. So what are the types of engagements and what are some of the projects where we have engagement? This is what we have. So on the left-hand side, you're going to see different types of engagement. So it can be anything from being a member of a consumer advisory board, being involved in a focus group, going through an in-depth interview, completing a community survey, even being the voice of advocacy, meaning going out and speaking in advocacy roles. On the right-hand side, you're going to see some of the projects that we currently have going on, where we have people with lived experience engaged. such as the guidelines for activity-based therapy. There's a lot of different engagement types within this project, not just as advisory boards, but also survey participants. We have the spinal cord stimulation survey, the open data sharing for SCI research. That's the survey, community survey as well. The community engagement project for high bandwidth brain-machine interface really uses all of these types of engagement in that project. Enhancing partnerships is another project that's looking at using advisory boards and focus groups and surveys. And finally, we're one of 15 members of the FDA Patient and Caregiver Connection Program, and we have lots of opportunities to bring your voice of advocacy. If you want to see a full listing of our current projects, you can see them at this link on our website. So we have something called the Project Engagement Database, and we use this database to recruit people to be advisors or in different types of roles of engagement when we have a new project that surfaces. So please sign up to our database. The link is right here. If you haven't signed up, or if you want to share it with your colleagues and friends who are living with spinal cord injury or caregivers or family members. When a recruitment opportunity surfaces, we reach out directly to you. And typically, what we'll give you when we reach out to you are things like the name of the project. We'll give you a brief description, who we're seeking to participate in this, and what types of, for instance, levels of injury, experience, geography, those types of things. We'll explain what the duties and responsibilities are for participation, what your time commitment will be. Also, what are the requirements for participation? For instance, what type of technology may be needed, or what types of skills that are being sought. And finally, what type of compensation there would be for participating. So now I'm going to hand it over to my colleague, Barry Monroe, who's the treasurer of the North American Spinal Cord Injury Consortium, to talk about the overview. Barry?
Thanks, Jen. As you can see on this diagram here, it really represents more of a holistic look at research in general. And many of us don't realize that us, with people living with lived experience, people living with spinal cord injuries, that there are many different roles we can play in the research process. And as you can see from the beginning of research, from the ideas to the development, and then how it's conducted, all of which we have an opportunity to be advisors in this process. And it's something that's somewhat new to us. And so we are now preparing to be ready for that opportunity. What we've done is we've decided to create something that's greatly needed in our community, is the SCI Research Advocacy course. It will be an online course that's designed to really provide a comprehensive training program to help you prepare to be an advisor. And the idea is that it would be, first, you would take an online static course, so to speak. And then the second phase of the course would be a live instructor with led sessions, where it would be either virtual or in person at some point after you've conducted the other sort. We're looking at it at some point next year. And then once you've graduated from the course, we will play an active role in matchmaking and finding trials that you might want to be part of. And of course, matching it with researchers in industry who are actively looking for these advisors to help them that way. Our job at NASPIC is really to facilitate the process and to really help those people that are living with a spinal cord injury become more involved in the research process. But to do that, we feel it's our responsibility, and as well our community's responsibility, to be ready for this opportunity so we can have a meaningful role when we have the opportunity. And of course, it's a free of charge course, so it is free to join, and we look forward to having you involved in that in the coming future. Really, just give you a background on what we've done with this. We've forged together a community engagement working group, and we've been actively working for over a year now, since July of 2020. And this group is made up of 20 individuals who represent many different areas of the SCI community throughout North America. And they include people with lived experience, consumers, caregivers, SCI researchers, physicians, and even industry representatives, really all aspects of what we call the research enterprise, so we can get that opinion in there. Upon an And above the working group, we are also soliciting individuals on a one-to-one basis to help comment on certain topics. We want to make sure that we get a really full breadth of everybody in our community giving us guidance on how to build this program. So the question is, how can you get involved with what we're doing here? Well, we're going to ask you to sign up with the project engagement database, and the link is here. Just by getting on that database and being part of our team, we will then reach out to you and solicit you to see how you might want to be involved with our advocacy course and really help us review the course down the road. That is a big part, that we want people from all aspects of people living with spinal cord injury, be it both. We want it to be the most diverse representation we can find, so that we have a real equitable approach in how we design this project. So we will be reaching out to you once you have joined the database to see how you'd like to become involved as a research advocacy course content reviewer. And then on top of that, we'd also like you to join what is called our team of SCItrials.org. SCItrials.org is a database that we're building together with others that is really consumer driven and giving us full access to all the trials and research trials that are being conducted, not only in North America, but throughout the world, where you may have a role and have an opportunity to either advise or you can be part of a recruitment process.
Thanks, Barry. So we're really excited to reach out to you to be involved with NASCIC, to get involved and be an advisor in spinal cord injury research, and to join us in the course and be prepared so we can be effective advisors, so that we can yield the best out of SCI research. So please join us at NASCIC, at the North American Spinal Cord Injury Consortium. Join us on our website and get involved through the engagement database. Thank you.